Hello, everybody. Hello, everyone. Hi, good to see you again. Thanks for returning again. Thank you for always coming back to watch my content. Thank you for the love. Thank you for the light. I really, really appreciate it so much. You have kept me going, and that's why I'm back here again. Yeah, I want to talk about how you can get a job in the NHS as an healthcare assistant or as a support worker, whatever suits you. I work in the NHS as an healthcare assistant, and I'm here to talk about how I got the job and what you can do if you want to work in the hospital, in the care home, domiciliary sector, if you don't have any work experience as a healthcare assistant or as a support worker before. Yeah. After my paper was sorted out, the next thing was for me to start working, and I was working towards it, trying to, because during my period of waiting, quote and unquote, I was able to do some, I was able to do some voluntary job as an healthcare assistant, and I fell in love with the job because I'm like, wait a minute, this job is okay. It suits my family needs. I can relate with it because I can plan my life around it. So I decided to start with the domiciliary sector, and I did not have any experience, but I was trained. But some agencies or some organizations don't like to train anybody. They don't want to employ anyone without any experience. But I was fortunate, so I got into the domiciliary sector, and I got little training. Then I was like, oh no, I want to get a better one. I moved to the care home, and I was searching. I put in a lot of CVs trying to apply, but they were not taking me. And I was like, what is wrong? Why were they not taking me? So I realized, okay, could it be because I don't really have much experience, or they think, oh, you haven't got all that it takes to work as an ex-care assistant, because they don't want to go through the stress of getting you in, and maybe after like 1 week or 2 weeks you realize you don't like the job and you fall out, if that is the word, and you stopped, and they have to start with the recruiting process again with another person. So I think they like to employ those that are experienced in the field, those that know what the job entails and won't give them any trouble because they know what they are coming in for. So what I did and what you can do first, if you haven't got any healthcare assistant experience and you have the passion, you want to work, especially in the NHS or in the care home, you can start by being a volunteer. Yes, you can just search online to any hospitals or any care home around you that you want, go on their website, send them an email that you would like to be a volunteer. Even some of all these care home hospitals always have a website about what detailing whatever they do in their organization, and they talk about how to be a volunteer or be a volunteer. That was what I started with in an hospital. I was going in like once in a week, like 4 hours, to get familiar with the hospital environment, to know what it takes. And I was like, okay, I think I like this. I like the environment, the patients, everybody, the colleagues, the workers. I'm like, I love it. So with that, I was able to get some experience, and I added that to my CV. I moved forward by going to searching for some hospitals, NHS precisely, because that's where I wanted to be. I just love it in the hospital atmosphere because I've already worked as a volunteer in the hospital. So I was now going on every hospitals around my area in my borough where I think I want to work. And I went to their website and submitted a form on expression of interest. That shows that you want to work, you are trying to let them know you have an interest in becoming an healthcare assistant. So what that does is that whenever they have a vacancy or need to employ, because you have shown an expression of interest, they will contact you. That's another way of getting into the NHS, into the care home as well, because that was how I started when I go into care home. And because I've already worked as a volunteer, that made it easy because okay, she's a bit familiar with the hospital environment. She can do and because I assist the healthcare assistant and the nurses as well, I know how to make the beds. I can now assist them to do the BAMs. I can assist them with personal care and to do one-to-one with some patient that needs one-to-one kind of monitoring. That also helps me. And you can also go further by doing some short courses online, like the care certificate course. You can decide to do it. In that course, it tells you about understanding the role of an healthcare assistant, how you can get in, what you need to bring to the table in terms of qualities, in terms of traits. I did all this care certificate course. And I went to a free school. It's a college, but it's free in as much as you have your paper. And I did health and social care level 2 and pre-access to nursing course. So there we're taught about the rudiment of healthcare service, what to expect in an healthcare environment, what you're going to be doing. I got my certificate, and I also did maths and English because if you want to work in the healthcare sector, because it's like a patient customer facing role, you are meeting patients, you are communicating with your colleague, so you need to be able to communicate. They want to know your standard and your level of English, your proficiency, how proficient you are in speaking, in listening, in writing, in reading, because you're going to be doing a lot of paperwork, writing, communicating, filling forms, expressing your mind. And when patients or colleagues talk to you, you must be able to respond. So they want to know how you can do this or how competent and your level of English speaking. So I did the functional skills, maths and English level 2. That also boosted me because I added that to my CV, and I then went ahead to register on Track. There's a website where mostly NHS recruits from. It's called track.jobs. trac.jobs. So I went there and I registered on the website, and I submitted my CVs. It brought out all NHS trust in London because that's where I live, and I was able to apply to many hospitals around. So that also helps me. You have to put in your details, submit your CV, and because I've got some experience now as a volunteer, and I've done some courses in healthcare, that also boosted me. And now, while I was doing this, I was able to secure a job in the care role, in the care home. So that helped me, and I got more experience. So I was able to, as I was doing all this, I was adding it to my CV, adding what I do in the care home. I can do this, I can do that. So that also pushed me forward. Okay, so whenever I do that, I go to my Track portal and amend my CV, add more, upload, I will just add more to the CV and post it again just for them to see. All this helped. And if you do this, if you have the interest of working as an healthcare assistant, that can also sell you out. So these were things that I did that really helped me out. So you can also do register as a bank staff. When you go to any NHS jobs app, just go to their bank staff portal section. Just register. You want to be a bank staff. What that means is that you want to be like a floating staff, temporary staff, whereby they will be calling you whenever they are short of staff, whenever they think they need more hands. And with that, you can become a permanent staff if you have interest. This were what I did. I registered with NHS jobs. I registered with Track jobs, and I've done level 2 health and social care. I've done functional skills in maths and English. I registered as bank staff through NHS bank office. I've already submitted an expression of interest form, and I was still, while I was doing this, I was still going for my volunteering role in another hospital. I was just trying everyone, whichever one comes first. Do you know what? The irony of it was that even the hospital where I was doing the NHS, where I was doing the volunteering, did not even employ me. Can you imagine? I think every hospitals with their own specification and whatever they want. So maybe I didn't meet up to whatever they want. I do not know. But because I've submitted my, I've already shown expression of interest in many hospitals. One of them called me and, oh, you've shown expression of interest. Are you still interested? I said, why not? So they called me for an interview, and that was how I got the job as an NHS healthcare assistant staff in that hospital. So the essence of this video is to let you know how you can secure a job as an NHS staff, as an NHS healthcare assistant, or as a care home healthcare assistant, or even in the domiciliary sector. If you don't have any work experience, you can start, you can begin as a volunteer. You can show expression of interest. You know, you just click on the form on that portal of that hospital, you know, and write your name, you know, tell them, oh, you want to work as an healthcare assistant. You give reasons why you think you want to do it, you know. Then try domiciliary sector as well. Just keep pushing it and try to do some courses like what I said. I did health care certificate course, and also did some short trainings like moving and handling. I did short course on medication administration. I did some course on food and safety, first aid, a lot, food and hygiene, a lot. I did a lot of courses. And as I was doing this, I was adding that to my CV, and that was pushing me up until I got the job. And here is where I am today. And that is how you can begin your journey in the health industry or sector if you have the interest. And to round it up right now, being an healthcare assistant does not mean that is the end or that's where you're going to be for life. Except if you think, oh, I don't want to become a nurse. I don't want to move up to become a midwife. I don't want to. You just don't want to step up the ladder. It depends. Everybody has gotten their own choice, but it is the beginning to a better height or to a greater height, whichever. So, but the first thing is that if you have the passion or you think, oh, this is where I want to be for your own personal reason, because I've got my own reason, it suits my availability, it suits my family needs, and because I want to progress into my nursing, I know I have to start and work in the health sector to push me forward. Okay, so that's that about this video. Thank you so much, everybody. Thank you, my returning subscribers. Thank you for the love and like. I remain to be Oba Wilson, and I will see you next in my next video. Bye.